Hello, ICS members and guests. My name is Ariana Smith, and I'm a urologist at the University of Pennsylvania. My abstract today is titled A Web-Based Survey of Bladder Health and LUTS in U.S. Women Using the LURN-SI and a National Research Registry. I have no relevant financial disclosures. Online research communities are becoming increasingly common and provide a low-cost resource for researchers as well as a low-burden opportunity for volunteers. These platforms are prime for studies utilizing self-reported measures to explore novel potential risk and protective factors. And they can be particularly useful to further understand the usability and performance of newly developed research instruments in additional populations. The objective of our study was to assess the response rate and feasibility of using ResearchMatch, a national online volunteer registry established by the National Institute of Health for the recruitment of study participants, to compare demographics, health characteristics, and lower urinary tract symptoms of respondents to published prevalence estimates, and to assess convergent validity, i.e., the ability to detect known associations of the new lower urinary tract research network symptom index LURN-SI 29 in community women. A cross-sectional survey of women recruited through ResearchMatch was performed to assess LUTS, LUTS-related risk and protective factors, and health characteristics and behaviors. A random sample of 18,609 of the 99,920 registered female and transgender volunteers aged 18 to 100 were contacted via email. A REDCap link was provided for the 100-question survey completion, which included the novel LURN-SI 29. Findings were compared to the Epidemiology of LUTS, or EPI-LUTS study, which used representative population-based sampling from an internet-based panel in the US, UK, and Sweden. Of the 18,609 randomly selected ResearchMatch volunteers who received our request to participate, 2,144 agreed and 1,747 completed the survey for a response rate of 9.4% of those contacted and a completion rate of 81.5% of those who agreed. Table 1 shows participant demographics and characteristics in ResearchMatch volunteers. Mean age was 44 years, 98.6% identified as female, 67.9% obtained a bachelor's or graduate degree, and 86.7% were white or Caucasian, making the sample younger, more highly educated, with similar racial ethnic diversity to EPI-LUTS. Most of our participants were insured, had a range of self-reported health, and BMI, similar to the EPI-LUTS study. Several medical comorbidities were present in our ResearchMatch volunteers, similar to that seen in EPI-LUTS participants. Many of our participants, however, had never been pregnant, and 45.4% were premenopausal, making our population less paris and less menopausal than that of EPI-LUTS. Table 2 shows the results of the LURN-SI 29 in our ResearchMatch participants, demonstrating a high prevalence and bother from lower urinary tract symptoms, similar to that seen in EPI-LUTS. Urgency, nocturia, and daytime frequency were highly prevalent, as were incomplete emptying, urinary tract infection, and bother from lower urinary tract symptoms. Table 3 shows the median LURN-SI 29 total scores and subscores increased with age and BMI. The total scores and subscores also increased with medical comorbidity, parity, menopausal status, urinary symptom bother, each decrement in self-reported health, and varied with education and race, thus providing evidence of convergent validity. In conclusion, internet-based recruitment for a bladder health survey is feasible. Participant demographics varied, but the prevalence and spectrum of LUTS were comparable to other population-based samples. Use of the novel LURN-SI 29 provided data on its performance outside of LUTS patients, demonstrating its ability to detect expected associations with demographic and health characteristics. Thank you.